Hello, good evening. Myself, Dr. Nikhil. Uh, First of all, I would like to congratulate everyone for a happy International Women's Day. March is celebrated both for Women's Day, but it is also considered as a kidney month. We celebrate World Kidney Day on the second Thursday of March every year. And this year we are celebrating it on 9th of March, that is tomorrow. And every year we have a unique theme to increase the awareness regarding kidney diseases. This year's World Kidney Day theme is Kidney Health for All, Preparing for the Unexpected, Supporting the Vulnerable. All of us know the basic functions of kidney, that is to purify blood and produce urine. However, it does not stop there. Kidneys have several other functions. It helps to keep the acid-base balance in the body, helps keep the blood pressure in check, production of hormones like active vitamin D, which is needed for the bones, erythropoietin for improving the hemoglobin, and some hormones needed for blood pressure maintenance. Kidneys are amazing. Many of us don't even give it a thought until something goes wrong with them. They are hardworking organs that deserve some love. Every year, the number of patients suffering from kidney diseases are rising to an alarming level. It's estimated that 1 in every 10 person worldwide suffers from chronic kidney disease, and it is considered to be the 10th biggest killer worldwide. The most common cause of chronic kidney disease today is diabetes mellitus. Kidney diseases usually goes through 5 stages. Stage 1, 2, 3, 4, and 5. Usually at stage 4 or 5, the patient may need hemodialysis or transplant. If the disease is picked up at early stages, the disease progression can be stopped or delayed. This year's World Kidney Day theme also stresses upon disasters, pandemics, that disrupt the optimal medical care supposed to be given to vulnerable patients. It stresses upon preparing for unexpected disasters such as pandemics, earthquakes, such as a recently witnessed horrific earthquake in Syria and Turkey, other disasters like cyclones, floods, landslides, etc. These disasters have time and again proven to be a reminder of the roadblocks in providing optimal medical care to our patients. The recent ongoing flu illness in Karnataka, S3N2 influenza strain, has also started plaguing our patients. However, it was the COVID-19 pandemic that took the world by a huge shock. We lost countless number of people, healthcare system was unprepared, and it crumbled under the huge deluge of sick patients. Hence, the World Kidney Day theme of this year, preparing for the unexpected, supporting the vulnerable. It stresses upon being ready and prepared for such calamities and disasters and keeping the vulnerable protected. Who are these vulnerable people? People with diabetes, hypertension, those with kidney disease, patients who are on dialysis, transplant recipients, elderly patients, pregnant females, children, and disabled are considered to be the vulnerable population. With disasters such as earthquakes, floods, essential and basic medical services get disrupted. These services may include food, water, medicine, electricity, everything. Patients who are on dialysis require basic services such as electricity and water so that dialysis can continue and they can survive. Similarly, patients who are on peritoneal dialysis may not get access to fluids or bags which are needed for performing peritoneal dialysis. Patients with diabetes may find it difficult to procure medicines for controlling sugars. In short, we all understand that disasters and pandemics will not knock on the door. COVID 19 gave us an example. It opened our eyes, and so our healthcare system needs to be ready and prepared for such events. Another important point that I would like to discuss is with regards to vaccination. Vaccination has a major role in protecting our vulnerable patients. Patients who are on dialysis, diabetics, elderly patients have a weak immune system. They are very prone for infections. COVID vaccines have shown us how a simple vaccine can help prevent serious COVID illnesses or deaths. Patients with kidney diseases should also be considered for additional vaccination. These vaccinations include pneumonia vaccine, influenza, and hepatitis B. This can help them prevent from dangerous infections and keep them well protected. In summary, our healthcare system should be upgraded to be prepared and ready for disasters, epidemics, or pandemics, and we should give adequate medical support to our vulnerable population, vaccinate them at the earliest. But most important of all, people should be educated. They should be made aware of kidney diseases, how to recognize the early symptoms. Simple basic blood tests and urine tests, blood tests such as serum creatinine and urine routine microscopy can help us identify kidney diseases at an early stage. Patients with long standing diabetes, hypertension, and those with a family history of kidney diseases should get their blood tests and urine tests done. Proper treatment at early stages can help delay the progression of the disease and can prevent them from going on to stage 4 or stage 5 chronic kidney disease, which may require ultimately dialysis or transplant. Thank you.